Alright, so we're going to start with the upper limb tension test, and this breaks us into kind of 3 different versions. The first one we're going to start with is the median nerve. That's one that you'll run into quite a bit depending on, where the patient's symptoms are, whether they have carpal tunnel or, potential entrapment of the elbow or even, spinal pathology. So we're going to really try to put tension along the median nerve all the way from the fingertips into the neck. The first step that you're going to do in the setup, you're going to block the patient's elbow with your knee here so that they're not going anywhere. You're going to traction down on their shoulder to create tension at the brachial plexus here. That's always going to be a key feature of every portion of this test. So traction down on the shoulder. The movement is going to be wrist extension, supination of the forearm, elbow, external rotation of the shoulder, and then we're going to extend the elbow, and this is most likely when they're going to start to really feel it, whether they have a problem or not. So it's normal you want to set the patient up with the expectation they're going to feel some stretch, or what you're interested in is if it reproduces something familiar. If it does, if they're like, oh, does that recreate any of your symptoms?
Mm-hmm.
If it does, what I'm going to do is I'm going to let go of the shoulder. If they're pain here, wherever it gets much better, then that's an indication that this is most likely from the median being driven by pathology in the median nerve. It doesn't tell you exactly where, but it might certainly incriminate the supraclavicular area because that's what we release the tension from. So that's the median nerve.